just heard at the Public Safety Community Health Committee for City Council, we just released our 2018 point-in-time data numbers. Some quick highlights are that we did see an overall increase this year on our homeless count. We are at about 1,245 people, which is an increase of 14% from 2017. However, we did see a decrease in our number of veterans experiencing homelessness, the number of unaccompanied and young people experiencing homelessness, as well as a decrease in the chronically homeless population. All three of those subpopulations are areas where we had a high concentration of efforts and initiatives in 2017, so we're happy to see that we were successful with those initiatives, but overall some work remains to be done. So at this time we'll take any questions about the data we just presented, and we'll have a handout for you shortly.
What are some important factors that people should consider when taking a look at these numbers? You know, we say that the number of homeless has increased by 14%, but as you guys mentioned, because there were some changes this year.
Yeah, there were substantial changes to the count this year. So I think the biggest piece is that we counted in 173 different locations throughout the county. So historically, we've really focused on our downtown core for where we've counted our homeless population. This year, we had significant expanded outreach. We had over 100 volunteers and some focus areas in the valley. We made it all the way out to Loon Lake, Deer Park as well. So we certainly counted in a far broader region, which we think had a lot to do with the reason for the increase.
Is anything being done to share or coordinate these numbers with the county or other cities in the county?
So we're the counter for the entire region as a part of the kind of the HUD regulation. So the way the funding works kind of dictates who in your region counts. So the city of Spokane is the regional lead. So we had close coordination with the county and some groups from the valley as well for this effort. They were very much a part of the team and on the planning committee and helped coordinate the effort as well. So it's a very close coordination, but from a federal perspective, we report on behalf of the region.
Did any of your numbers show that stuff you guys have been doing in the past is working?
Yes, if you look at kind of our veterans populations and the chronic populations and the youth populations, we saw substantial decreases from last year's numbers, as well as continuing downward trends for families experiencing homelessness. So when you think about kind of the 100-day, 100 youth challenge we did this summer, we saw a direct correlation to our youth numbers going down for the last probably 5 or 6 years. There's been very targeted efforts at the veteran population. We continue to see that population experiencing homelessness at a less frequent rate. And the chronic population, which is a group that's been very heavily targeted both at a federal level as well as locally through a lot of the housing units you've seen go up downtown, have really directly impacted the decrease there for the chronically homeless population. Part of the kind of national and local objective is that homelessness is rare, brief, and non-recurring. And so we're certainly seeing, when that chronic number goes down, we know that it's becoming less of those three things, which is the goal.
Is there anything you've learned from this year's count that you'll be taking with you in future counts?
A lot, yeah. I mean, I think as David and Tisha alluded to in our committee presentation, the mobile data collection is a huge win for our community. So historically, we've counted, pencil and paper, which has really limited our ability to reach people. It takes a lot more time, and also takes a lot more time to tabulate and respond to the data. So we'll continue with mobile data collection. It also allowed us to do GIS overlays and really get a better handle on where we're identifying people, especially those who are unsheltered. As we continue to do a more regional effort, having that heat map data will really help us cater interventions to those who are in our more rural communities. So that will continue. We also had like I said, a large our volunteer population this year. We'll continue that into next year to make sure that our outreach teams are really well supported and being able to get to as many areas to count as possible.
Now, it seems clear to me, but I have to ask, why is this such an important number to have in our community and to have this idea of our homelessness here?
So it's for many reasons. One is that it helps us redirect funding. So if we understand who's on our streets experiencing homelessness, we're better able to craft solutions that will help end that homelessness. And on top of that, it helps us, and it's required by us to report to the federal government on who in our community is experiencing homelessness and whether they're sheltered or unsheltered. So we're mandated to do the work, but most importantly, at a local level, it helps us figure out how we try and intervene and stop that cycle of homelessness. And more importantly, to try and prevent it as well. You heard in the committee presentation, we asked some questions that are not required that we ask at a federal level to try and create local solutions. So we're trying to be more innovative on how we apply kind of the federal requirements at a local level for the most bang for our buck.
Were there any significant demographic differences between the unsheltered and sheltered groups of homeless people?
In terms of like gender?
Yeah, gender, age, or family status, anything that stuck out?
So So it's very few families in our unsheltered count. So the primary group of folks who are unsheltered are individuals. They may be, 18 to 24 years old, but not families. And overall, we see about a 40-60% split between male-female. So that rings true in that unsheltered population as well.
And 60% male.
Male, yeah. I think might be 38% female to be detailed, but about a 40-60 split.
Okay. And did you guys count people who were doubled up?
No. So the challenge of the point-in-time count is that there are two different definitions of homelessness at a federal level. One is created by the Department of Education, which does count doubled-up families or children. The second definition of homelessness at a federal level comes from Housing and Urban Development, which does not include doubled-up households as part of its figure. So this does not include any doubled-up figures, which we know would be a much higher statistic. And doubled up really just refers to anybody staying with an aunt, uncle, friends, family, and not literally on the streets or in a shelter.
I just have a clarification question. So we have the number of persons and then we have households. Can you tell me the difference between that?
Yeah, so the household number accounts for how many groups of people identify as being in a family. So if you've got a family of 4 experiencing homelessness, you're going to be counted once in the household count and as 4 individuals in the individual count.
Thank you.
Yeah, so the household count number is therefore lower.
What was the question or criteria to decide if someone was chronically homeless?
So that's actually a federally defined status, meaning that you've been homeless, and correct me if I get this wrong, for at least 12 months or more than 3 or 4 times in the past 12 months with a disabling condition. So we ask those questions in the survey to determine somebody's chronic status.
I guess I have one more question. Moving forward, any programs that will be, I guess, adjusting because of what you guys are learning from this? I know it's still early, but how does that all work, bringing this data into your programs and adjusting it?
Great question. So yes, I mean, we'll be doing, so the CHHS department, which Kelly manages, handles the federal dollars to support homeless efforts, which kind of go through their own contracting process with local providers. We also manage a large bucket of other state and local resources to address homelessness. And we'll be coming out in this fall with our first kind of 5-year RFP that will award, historically we've done 1-year funding allocations for nonprofits, some 18-month allocations. This will be our first transition into doing 5-year contracts, and any information gleaned from this experience, as well as a handful of work groups we've had assisting us in determining need, we'll be putting that out for RFP to try and contract for the services that we believe will best impact this number to reduce homelessness overall. So the federal funds operate a little bit differently, but those funding opportunities coming out will directly correlate to the information we've received, both in the point-in-time data as well as kind of our work groups and nonprofit providers about what do we need to be doing locally to do the best we can.
And is that when we'll see renewals for shelters that are within the 24/7 system?
Can you repeat that? Sorry.
Is that where we're going to see renewals for shelters that are part of the 24/7 system?
Yes, so the goal is that the shelter system will be included in that. It may have a separate RFP depending on the timing of when things need to get moving, because it's possible that we would need, the RFP will come out this fall for a July 1, 2019 start date. Our shelter providers may or may not need a different timeline for implementation, but yes, you'll see that RFP coming as well.
And I guess overall, when you look at these numbers and the trends over the past couple of years, what direction do you think the city is heading in handling homelessness here in Spokane?
I think we're doing a great job. We're not perfect by any means, but overall our trends continue downward. So I think that we're headed in the right direction. I think Spokane's lucky to have some really innovative nonprofit providers and elected officials who are willing to try new things. So we'll continue to do that. It's certainly, as we cover more of our county with the count, we're going to see those numbers increase. So I don't think we were surprised by that this year. Counting 173 locations is a lot, so we knew there was going to be a jump. I think we were a little bit relieved that it wasn't as big of a jump as we had potentially anticipated. So I think we're headed in the right direction. We're certainly not there. You can see it in our downtown streets and our rural areas that there's still a problem to solve, so we'll continue to do that. But I think we're absolutely headed in the right direction. We're focusing really strongly on performance of our providers. So yes, you're serving the homeless population, but how well are you able to assist them in finding housing or finding employment to maintain a stable life? So we're going to be continuing to look at performance outcomes and making sure that what we're funding is actually creating change.
And then just a quick question. You said 173 locations this year. Is there an average from past years?
Good question.
Because I have zero context.
We can
It's like a
certainly.
big number to me, but.
I mean, I think the biggest change really was we've historically really counted within shelters that we knew people were staying, or done an outreach in just the downtown core. So this is the first year that we've really had count sites in food banks in Deer Park, food banks in Loon Lake, really getting on the ground foot outreach to unsheltered populations in the valley, and more rural areas. So I don't have an exact number, but this was a vast expansion of what's historically been targeted just in our downtown core. Any other questions? Great. And I think Julie's got a handout for you that you can take on your way out.